Hi everyone, I took an NBCOT mock exam with TrueLearn, and today I'll be sharing my experience, my results, and my performance report to show you how TrueLearn can help you on your studying journey. If you're new here, my name is Brianda. I am the writer and creator of the OT Latina blog, where I share occupational therapy tips and cultural insights for students, practitioners, and parents. So first, I want to thank TrueLearn for sponsoring today's video. I remember when I was studying for the NBCOT exam, and one tool that really helped me build confidence in my test-taking skills was TrueLearn. TrueLearn is an online study platform that offers over 1,800 NBCOT-style practice questions, and today I will be highlighting their free Prepathon event. And make sure you stick around till the end of this video so that we can review a practice test question together. The Prepathon is a chance to take a practice exam with over 50 questions. After the exam, I received a detailed performance report where it highlighted my strengths and weaknesses, and I was also allowed 7-day access to review all questions on the exam, including their explanations. Now, this Prepathon event was a great way to simulate the actual exam and show you what areas you could improve on. Okay, so let's get right into it. So my initial thoughts after the exam were that the questions were very similar to the actual NBCOT exam. Now, I've mentioned this in other videos, but TrueLearn was really one of my favorite study tools because the questions on their practice test questions really closely matched the actual NBCOT questions, and the rationales are so thorough and easy to understand. They really help you not just answer the questions, but they help you build and improve on your clinical reasoning skills. Okay, so let's take a look at the detailed performance report because this is actually what's really helpful. So the first thing that you see on your performance report is your overall score. And as you can see on my exam, I scored a 70%, which is technically passing. But keep in mind that I have not taken an NBCOT mock exam or practice test in over 5 years, so I am a little rusty. Okay, let's go over some of the features that I want to highlight on this performance report. First, it shows you what area you performed the lowest in. And as you can see on my report, I scored the lowest on domain 4, which is competency and practice management. This helps you quickly identify which area you need to focus your studying on. Next, you have the answer change analysis. This shows you how often you change your answers and whether those were correct or incorrect. So I really like that the performance report showed you this information because one of my biggest tips is to not second guess your answers. A lot of times when you go back and change your answer, it leads to a lot of overthinking and mistakes. So I really appreciated this information because it showed me whether me changing my answer was actually helpful or more harmful to my overall score. Next, the report shows performance by domains. This shows you how you did in each content area, which really helps you tailor your study plan. And then, of course, you get to review all of your test questions. So one thing TrueLearn really does well is separating the questions by topic and categories. So this is really helpful when you're navigating their OT Smartbank because you can go in and create your own custom practice tests, and you can create these tests by category or topic. So for example, if you only wanted to take a quick practice quiz of like maybe 10 questions, you can make all of those 10 questions just pediatric topics. But yeah, getting to review your questions for 7 days after the Prepathon really just shows you what areas you need to focus on and what areas you're performing really well on. Lastly, on the performance report, it shows you how long you took per question. Now, this is just an average, but as you can see on my performance report, I took about 51 seconds to answer questions that were correct. Like I've mentioned in other videos, knowing how to pace yourself during exams is so important, especially if it's a timed exam, because you do not want to run out of time during the actual exam. Overall, I thought this mock exam was both challenging and realistic. It really took me back to when I was studying for boards where I really had to rely on my clinical reasoning and work on my problem-solving skills to answer each question. The performance report was incredibly helpful and really gave you direction on how you need to tailor your study plan and what areas you need to focus on. And again, one of my favorite features about TrueLearn in general is that they have the best rationales of any practice test materials that I have used before. If you haven't already, you can go to my previous video and check out some of the features that TrueLearn has to offer that can really help you pass the NBCOT exam. Okay guys, it is now that time to review a quick practice test question, and this is really informal, so I just have my laptop here and we will work through this together. So the question is, an OTR is providing an intervention to a client who has a diagnosis of lateral epicondylitis. The OT introduces ice massage as a preparatory activity. Which part of the upper extremity is most appropriate for the OTR to provide ice massage? First things first, before I look at the answer choices, I just kind of like to review the question a little bit. It's asking about lateral epicondylitis. Immediately, this is why it's important to understand and know your anatomy. So lateral epicondylitis, also known as tennis elbow, is caused by excessive extension of the elbow. Now the OT is trying to apply ice massage on the area that is affected. And the question is asking which part of the upper extremity should they put this ice on. So now if we look at our answer choices, we have A, the common flexor attachment of the elbow, which is an automatic no because I already established that tennis elbow or lateral epicondylitis is caused by excessive extension of the elbow, nothing to do with flexion. So that one is a no. Then we have answer choice B, the common extensor attachment of the elbow. So automatically my brain is thinking, okay, extensor attachment of the elbow, that makes total sense because that is where the lateral epicondylitis injury occurs. Next, we have answer C, which is the pronator quadratus. And again, knowing your anatomy, the pronator quadratus, which is responsible for pronation, which is bringing the wrist downward, so turning it down like this, that muscle is actually distal to the elbow. So it's not the upper elbow, it's distal. It's like the arm, it's the wrist, right? It's at the bottom of the wrist. So pronator quadratus is located right here at the bottom of the wrist. So that is not the answer. And lastly, we have the pronator teres. So again, if you know the function of your muscles, you would know that the pronator teres is not an extensor muscle. The pronator teres is responsible for turning the forearm down or pronating the forearm. And this muscle is located at the bottom of your forearm, not on the top where all the extensor muscles are, but right here at the bottom. So answer D is not the answer. So on the exam, I did choose B, the common extensor attachment of the elbow, and I got it correct. Okay, so quickly, let's go through the rationale. We're going to scroll down to the bottom where it tells you why the other answers were wrong. So answer A was wrong because golfer's elbow, which is medial epicondylitis, ice massage would be best provided to the common flexor attachment. So if you have a flexor attachment injury, that is actually medial epicondylitis. Answer C was not correct because the pronator quadratus is distal to the elbow. So for example, in the question, it was asking which part of the upper arm would you apply the ice massage? And so this is not part of the upper arm. This would not be the correct answer. And lastly, answer D, the pronator teres is commonly associated with repetitive strain injuries of the wrist and elbow. The median nerve can become entrapped, resulting in parallel symptoms associated with carpal tunnel syndrome. Okay, so there you have it. That was a pretty simple practice test question, but I hope that it was helpful. And feel free to check out some of my previous videos where I answer more of TrueLearn's practice test questions. If you're ready to try TrueLearn Smartbank, I do have a discount code. You can use code OT Latina for 15% off of TrueLearn's OT Smartbanks. And if you are a COTA, TrueLearn is offering another Prepathon event. This event is happening in May, and it is a free and virtual event. I will link details down below so that you can register for that for free. And again, if you're studying for boards right now, feel free to check out some of my previous videos where we complete practice test questions together. Thanks so much for watching. Please remember to like and subscribe, and I will see you guys in the next video. Bye.